Vision is more than 20/20 acuity. Poor binocularity, eye teaming ability, or ocular motor skills, eye movement ability, can cause great challenges to learning. A behavioral vision evaluation is comprised of many assessments used to measure binocularity and ocular motor skills. The visograph is one of the assessments used to measure ocular motor skills. The patient wears goggles which contain infrared sensors that record eye movements. The visograph also calculates reading efficiency and comprehension. After a behavioral vision evaluation and perceptual evaluation, a diagnosis is reached, and if a visual deficiency is detected, it can be corrected with vision therapy, which consists of 3 phases: motor, ocular motor, and visualization. Phase 1, motor phase. Motor coordination develops in a sequential order, from gross motor to fine motor. If there is a delay in motor development, the ocular motor system, which is a fine motor skill, will be adversely affected. The first phase of vision therapy focuses on the skills of integrating infantile reflexes and improving balance and rhythm. All infants are born with infantile reflexes, which are involuntary. These reflexes lay the foundation for the development of integrated motor control. When primitive reflexes become integrated, they provide a strong foundation for more sophisticated and specialized voluntary movement patterns, like those needed for good eye control, focusing, binocularity, bilateral integration, eye-hand coordination, and visual motor integration. The moral reflex is thought of as a survival reflex in which a baby perceives a threat, goes into flexion, fetal position, or extension. This reflex should be integrated by 4 months. If it is not, the child may have difficulty controlling the upper and lower halves of the body in isolation. The duck and pigeon walk is used to help integrate the moral reflex. If the reflex is integrated, the child should be able to walk like a duck or pigeon without any movement of the upper body. The vestibular system controls the sense of movement and balance. Being aware of where a person is in space will be challenged if the balance system is underdeveloped. The ability for an individual to do cross-lateral movements or the ability to cross the midline will have a direct impact on one's ability to read, spell, write, and do serial decoding. Also, as children mature, their ability to use rhythm is seen in their patterns of coordinated movements, such as crawling, walking, running, skipping, and jumping. Later, rhythm becomes essential in regards to language development, reasoning, logic, timing, and finally, understanding of mathematics. Building a good foundation in motor skills is essential for phase 2 of vision therapy, the ocular motor phase. Phase 2, ocular motor phase. The ocular motor phase focuses on eye binocularity and movement. Convergence and divergence skills allow the eyes to function as a team to create single vision. Oftentimes, before the eyes are ready to work binocularly, they need to work independently. An eye patch is used with specific ocular motor activities to create equal strength of both eyes. This reduces the tendency to suppress one eye and let the other become dominant. This will lead to the ability to experience simultaneous perception, which is the building block for depth perception. The Marsden ball helps the patient create smooth eye movements and is often used monocularly at the onset of therapy. Once monocular proficiency is achieved, the patient is ready to begin binocular work. A Brock string is a good tool used to strengthen vergent skills by aiming both eyes on one bead and maintaining focus. The eyes then jump from one bead to another to gain proficient focusing skills. An aperture rule is another tool used to increase convergence and divergence skills. The patient must merge the image and hold to strengthen accommodation skills. The images become further apart and farther away, while the patient maintains fusion. This is a high-level ability which assists in binocularity skills that are necessary for all areas of academics. Good readers are able to converge, hold the eyes on a near target, and track the eyes across a page of text smoothly. The ocular motor phase focuses on the mechanics of the eyes and the skills necessary to read efficiently. Phase 3, visualization. The third phase of vision therapy focuses on improving visual memory skills through visualization activities. It is crucial for students to be able to use the visual system effectively. If a child is trying to memorize words that are not linked to concepts, the information seems irrelevant. Words need to be translated into pictures in the child's head to create meaning. Visual memory and learning progresses from concrete to abstract. Developmentally, objects can be visualized first, then pictures, symbols, and words. The shell game is an activity used to enforce the skill of picturing objects. The patient sees 3 objects, loads them into visual memory, and then is given instructions. For example, imagine that the purple block and the turtle switch places. What order are the objects now? The patient answers the question without seeing the objects, but by remembering the original order and manipulating the mental image. Once the patient masters the skill of imagining objects, pictures are used to teach visualization. The image string is an excellent activity to teach this skill. The following is an image string of all 44 presidents of the United States. Patients are instructed to remember the image to recall the information. Visualization of symbols is required before a patient is able to string the symbols of letters together to make words. Good spellers are able to visualize whole words and do not rely on phonics to sound out words when writing. Good readers are able to track their eyes across the page efficiently, decode words fluently, and create a visual image of the text to acquire meaningful comprehension. The ability to learn and become an accomplished reader requires properly developed visual processing skills. Those skills can be taught and enhanced through vision therapy at Institute of Shelby.